Test Prep MACE Actual Exam Questions. Question 1. What includes information that should be located on the MAR? Option A. Medication dose. Option B. Client's next of kin. Option C. Medication side effects. Option D. Agency medication administration policies. The correct answer is option A. Medication dose. Question 2. When should a medication aide report a medication error to the supervisor? Option A. Before the next medication is due. Option B. During the end of shift report. Option C. As soon as the error occurs. Option D. After calling the physician. The correct answer is option C. As soon as the error occurs. Question 3. What is 1 teaspoon of an elixir equal to? Option A. 10 milliliters. Option B. 5 milliliters. Option C. 1 ounce. Option D. 1 pint. The correct answer is option B. 5 milliliters. Question 4. Which of the following is a symptom of anaphylaxis, a life-threatening allergic reaction? Option A. High blood pressure. Option B. Quiet breathing. Option C. Slow heart rate. Option D. Wheezing. The correct answer is option D. Wheezing. Question 5. What should be the site selected for applying a transdermal patch? Option A. Cold. Option B. Warm. Option C. Hairless. Option D. Odor-free. The correct answer is option C. Hairless. Question 6. Why is it important for you as a medication aide to introduce yourself to the residents? You are asked by the Certified Nursing Assistant, CNA, to give a resident his pain medication. You know your responsibility as the medication aide is to see that this request is followed up. Who should give further clarification? Option A. The resident. Option B. Another CNA. Option C. The manager. Option D. The resident's roommate. The correct answer is option C. The manager. Question 7. Which of the following actions may the MA complete appropriately? Option A. Administering medications. Option B. Ordering medications. Option C. Assessment of the resident's condition. Option D. Evaluating the effectiveness of medications. The correct answer is option A. Administering medications. Question 8. The medication aide is responsible for administering blank blank. Option A. Only the medications learned in school. Option B. Medications under the direct supervision of a nurse. Option C. Medications by all routes. Option D. Expired medications. The correct answer is option B. Medications under the direct supervision of a nurse. Question 9. Before giving a medication, the label is checked for all of the following except blank blank. Option A. Dosage. Option B. Expiration date. Option C. Name. Option D. Cost. The correct answer is option D. Cost. Question 10. There are 6 rights of medication administration. They include all the following except for blank blank. E. Right time. Option A. Right dose. Option B. Right medication. Option C. Right patient. Option D. Right place. The correct answer is option D. Right place. Question 11. A fellow medication aide going on break hands you a crushed pill and asks you to administer it to a resident. Which of the following responses is required from you as in MA? Option A. To give the medication right away. Option B. To ask your fellow medication aide what the medication is and to administer it if it is the correct medication. Option C. To politely refuse to do the other medication aide's work and to let him or her give the medication when he or she returns from break. Option D. To refuse to give the medication because it cannot be properly identified. The correct answer is option D. To refuse to give the medication because it cannot be properly identified. Question 12. All medication orders must be complete and written in a specific format. This format includes all the following except for blank blank. E. Route of administration. F. time frequency for the medication to be given. G. Signature of the healthcare provider who wrote the medication prescription. Option A. Patient's name. Option B. Name of the drug. Option C. A pharmacist's signature. Option D. Dose. The correct answer is option C. Pharmacist's signature. Question 13. Give ibuprofen for pain every 6 hours as needed. What component of this physician order is missing? Option A. The route. Option B. The dose. Option C. The frequency. Option D. The condition. The correct answer is option B. The dose. Question 14. The medication aide is preparing to administer morning medications to residents. What is one important safety rule? Storing medications is an important responsibility for the medication aide. Which of the following actions demonstrates the correct storing of a medication? Option A. Medications with similar names are stored close together. Option B. Mr. and Mrs. Jones's medications are in the same medication storage bin. Option C. All medications are stored in their own prepackaged containers. Option D. Once medications are opened, they are all kept in the cart, regardless of the directions on the packaging. The correct answer is option C. All medications are stored in their own prepackaged containers. Question 15. The MA is about to administer a medication, but the resident requests that the MA leave the medication on the counter for him or her to take later. What is the correct course of action for the MA? Option A. Leave the medication as requested by the resident. Option B. Advise the nurse or supervisor that the resident refused to take the medication. Option C. Inform the resident that it is against institutional policy to leave the medication, and instruct the resident to call when he or she is ready to take the medication. Option D. Call the doctor and inform him or her that the resident is refusing to take the prescribed medication. The correct answer is option C. Inform the resident that it is against institutional policy to leave the medication, and instruct the resident to call when he or she is ready to take the medication. Question 16. All of the following are types of oral medications except for blank blank. Option A. Powders. Option B. Lotions. Option C. Syrups. Option D. Coated tablets. The correct answer is option B. Lotions. Question 17. All of the following are topical medications except blank blank. Option A. Ointments. Option B. Foams. Option C. Gels. Option D. Syrups. The correct answer is option D. Syrups. Question 18. When a medication is ordered to be given sublingually, how is it given? Option A. By mouth. Option B. Placed in the cheek. Option C. Placed under the tongue. Option D. Instilled in the nasal cavity. The correct answer is option C. Placed under the tongue. Question 19. When a medication is ordered to be given in the buccal cavity, how is it given? Option A. By mouth. Option B. Placed in the cheek pocket. Option C. Placed under the tongue. Option D. Instilled in the nasal cavity. The correct answer is option B. Placed in the cheek pocket. Question 20. When a medication is ordered to be given how is it given? Option A. By mouth. Option B. Placed in the cheek. Option C. Placed under the tongue. Option D. Instilled in the nasal cavity. The correct answer is option A. By mouth. Question 21. When patients are taking metronidazole, flagyl, which of the following should they avoid? Option A. Fatty foods. Option B. Sweetened beverages. Option C. Alcoholic beverages. Option D. Salty foods. The correct answer is option C. Alcoholic beverages. Question 22. A common medication for thyroid problems is levothyroxine, Synthroid. Which one of the following adverse effects can this medication cause? Option A. Fast heart rate. Option B. Slow heart rate. Option C. Low blood pressure. Option D. High blood pressure. The correct answer is option A. Fast heart rate. Question 23. What is the most common side effect of the diabetic drug metformin? Option A. Low blood sugar. Option B, diarrhea. Option C, sleepiness. Option D, change in pH. The correct answer is option B, diarrhea. Question 24. What medication is often prescribed for a patient who has depressive disorder symptoms? Option A, amitriptyline. Option B, promethazine. Option C, propranolol. Option D, rifampin. The correct answer is option A, amitriptyline. Question 25. Which of the following are used to classify medications? Option A, actions or indications. Option B, side effects. Option C, contraindications. Option D, interactions. The correct answer is option A, actions or indications. Question 26. Antibiotics need to be given on time for all of the following reasons except for blank blank. Option A, to maintain the blood level. Option B, to keep the infection from coming back. Option C, to prevent the overgrowth of another infection. Option D, to cause the infection to go away quickly. The correct answer is option C, to prevent the overgrowth of another infection. Question 27. Which of the following is the action of an antiviral? Option A, prevents the virus from making more virus. Option B, kills the virus. Option C, subdues the virus so that the body's own defenses can take care of it. Option D, increases killer T cells to destroy the virus. The correct answer is option A, prevents the virus from making more virus. Question 28. Diuretics are ordered first for high blood pressure for all of the following reasons. Which reason is the exception? Option A, they have the fewest side effects. Option B, they work the best. Option C, they work the most quickly. Option D, they decrease urination. The correct answer is option D, they decrease urination. Question 29. Diuretics are medications that are primarily prescribed for a patient with the following conditions blank blank. Option A, swelling of the feet and ankles. Option B, low sodium levels in the blood. Option C, low blood pressure. Option D, feelings of lightheadedness upon standing. The correct answer is option A, swelling of the feet and ankles. Question 30. True or false, residents have the right to refuse to take medications. Option A, true. Option B, false. The correct answer is option A, true. Question 31. Which of the following may cause a medication error? Option A, giving a resident their pain medication as requested. Option B, following the rights of medication administration. Option C, being familiar with the medication. Option D, talking with colleagues while administering medications. The correct answer is option D, talking with colleagues while administering medications. Question 32. An MA reviews the medication administration record and notices that an error has occurred. A resident was given the wrong medication. What should the MA's first action be to? Option A, inform the resident. Option B, call a lawyer. Option C, inform the nurse or supervisor. Option D, call the physician. The correct answer is option C, inform the nurse or supervisor. Question 33. Many medications have side effects. Which of the following is a side effect that the medication aide should watch for when giving an antidysrhythmic medication? Option A, increased energy. Option B, fatigue. Option C, low heart rate. Option D, high blood pressure. The correct answer is option C, low heart rate. Question 34. One important way to note if a resident's behavior is different from the norm is by doing blank blank. Option A, asking the resident whether this behavior is usual for him or her. Option B, being familiar with the resident's normal behavior. Option C, asking the supervisor about each resident's normal behavior. Option D, checking with the CNA who cared for the resident last week. The correct answer is option B, being familiar with the resident's normal behavior. Question 35. For which group of patients should dosages be calculated by weight? Option A, small adults. Option B, very large adults. Option C. Children. Option D. The elderly. The correct answer is option C. Children. Question 36. A medication is given for anxiety but causes the resident to become more anxious. This is called a N blank blank effect. Option A. Idiosyncratic. Option B. Paradoxical. Option C. Antagonist. Option D. Agonist. The correct answer is option B. Paradoxical. Question 37. A couple of antipsychotic medications are known to have caused cases of muscle pain and muscle breakdown. This type of drug reaction is known as blank blank. Option A. Idiosyncratic. Option B. Paradoxical. Option C. Antagonist. Option D. Agonist. The correct answer is option A. Idiosyncratic. Question 38. When the drug naloxone is administered to block the effects of an opioid narcotic, the drug action is known as blank blank. Option A. Idiosyncratic. Option B. Antagonist. Option C. Agonist. Option D. Paradoxical. The correct answer is option B. Antagonist. Question 39. Requip is a medication used to decrease restless leg syndrome and is a treatment for Parkinsonism by mimicking dopamine in the brain. What type of drug is Requip? Option A. Idiosyncratic. Option B. Antagonist. Option C. Agonist. Option D. Paradoxical. The correct answer is option C. Agonist. Question 40. Levothyroxine, Synthroid, should be administered early in the morning, on an empty stomach, and the resident blank blank. Option A. Will need to wait 3 to 4 hours before eating or drinking anything. Option B. Should not eat for at least 1 hour but may drink soda or milk. Option C. Should wait 15 minutes before eating. Option D. Should wait at least 30 minutes before eating or drinking. The correct answer is option D. Should wait at least 30 minutes before eating or drinking. Question 41. When is metoclopramide, Reglan, given? Option A. 1 hour before meals. Option B. 30 minutes before meals. Option C. 1 hour before meals and at bedtime. Option D. 30 minutes before meals and at bedtime. The correct answer is option D. 30 minutes before meals and at bedtime. Question 42. A resident is prescribed a new antihypertensive medication known as a beta blocker. After 3 days on the medication, the resident's heart rate is 54 and he complains of wheezing. Which of the following is the best action for the MA to take regarding medication administration of the beta blocker? Option A. Wait until bedtime to give the next dose. Option B. Hold the next dose and report to the nurse. Option C. Give the medication and report to the nurse. Option D. Call the physician and report the resident's response. The correct answer is option B. Hold the next dose and report to the nurse. Question 43. Which of following is not a side effect of phenytoin, Dilantin? Option A. Confusion. Option B. Hyperactivity. Option C. Sleepiness. Option D. Rash. The correct answer is option C. Sleepiness. Question 44. What is known as the reaction to anti-hyperglycemic medication that causes a person to shake and feel nervous? Option A. Hyperglycemia. Option B. Hypothyroidism. Option C. Hypoglycemia. Option D. Hyperthyroidism. The correct answer is option C. Hypoglycemia. Question 45. Which of the following actions could lead to a battery charge? Option A. A resident asks you to stop a procedure. You inform him or her that you have been instructed by his or her physician to complete the procedure. You complete the procedure over the objections of the resident. Option B. You explain a procedure to a resident and do the procedure after asking permission. Option C. You stop a procedure when asked to do so by the resident. Option D. At his or her request, you give medication to calm the resident so the procedure can be performed. The correct answer is option A. A resident asks you to stop a procedure. You inform him or her that you have been instructed by his or her physician to complete the procedure. You complete the procedure over the objections of the resident. Question 46. An MA can be charged with negligence when he or she administers the correct blank blank. Option A, medication. Option B, medication to the right person. Option C, medication to the right person in the wrong way. Option D, medication to the right person in the right way. The correct answer is option C, medication to the right person in the wrong way. Question 47. A nursing assistive personnel such as a MACE or CNA blank blank. Option A is a licensed nurse. Option B may practice in the same way as a nurse. Option C cannot be charged with negligence. Option D can work within their job description. The correct answer is option D, can work within their job description. Question 48. What is the average daily dose of the oral hypoglycemic agent glyburide, glucotrol? Option A, 5 mg to 10 mg TID. Option B, 2.5 mg to 20 mg BID. Option C, 2.5 mg to 20 mg QID. Option D, 2.5 mg to 20 mg QD. The correct answer is option D, 2.5 mg to 20 mg QD. Question 49. Diazepam is a medication used for anti-anxiety and seizure control. Diazepam is a controlled substance. To which class/schedule does diazepam belong? Option A, Class 1. Option B, Class 2. Option C, Class 3. Option D, Class 4. The correct answer is option D, Class 4. Question 50. Clarinex is a medication that is available as an over-the-counter drug. The drug's action is to reduce blank blank. Option A, allergy symptoms. Option B, stomach upset. Option C, pain from arthritis. Option D, gas. The correct answer is option A, allergy symptoms. Question 51. The medication aide is responsible to know the medical information of blank blank. Option A, all residents at their place of employment. Option B, residents she is assigned to. Option C, all residents on the unit or floor. Option D, residents assigned to their supervising nurse. The correct answer is option B, residents she is assigned to. Question 52. Which of the following is the responsibility of the medication aide? Option A, giving the first dose of a newly ordered medication to the client. Option B, converting medication dosage from milligrams to micrograms. Option C, withholding a patient medication without reviewing it with the nurse first. Option D, giving PRN medications ordered after checking with the resident's nurse. The correct answer is option D, giving PRN medications ordered after checking with the resident's nurse. Question 53. Which of the following is not a role limitation of a medication aide? Option A, observe the client's need for, or response to, medications, including PRN medications. Option B, make decisions that might include withholding medications. Option C, report changes in client status regarding drug therapy to ensure client comfort and safety. Option D, call the physician about client status or need for medication. The correct answer is option C, report changes in client status regarding drug therapy to ensure client comfort and safety. Question 54. The nurse you are to work with for the upcoming shift informs you, the medication aide, that she will be late today and asks you begin to administer medications. With regard to this scenario, which of the following statements is correct? Option A, medications that are usual for the residents can be administered without the nurse present. Option B, all medications can be administered without the nurse present. Option C, no medications can be administered without supervision. Option D, no PRN medications can be given without appropriate supervision. The correct answer is option C, no medications can be administered without supervision. Question 55. Maintaining competence refers to the blank blank. Option A, knowledge, skills, and attitude necessary to fulfill the role as in MACE. Option B, MACE gaining greater knowledge to perform newer skills. Option C, MACE who does not have the necessary skills to do something successful. Option D, person who cannot perform the role of a medication aide due to mental deficiency. The correct answer is option A. Knowledge, skills, and attitude necessary to fulfill the role as in MACE. Question 56. Verbal communication skills include speaking clearly and at level residents can understand, avoiding medical jargon, and blank blank. Option A. Asking open-ended questions that discourages a yes/no response. Option B. Using phrases to stop residents from sharing feelings. Option C. Interrupting patients when they are taking too long to answer questions. Option D. Using authoritative language to get the resident to follow directions. The correct answer is option A. Asking open-ended questions that discourages a yes/no response. Question 57. Unlawful personal violence toward a resident, for example, forcing residents to take medications despite their wishes, is the definition of blank blank. Option A. Abuse. Option B. Neglect. Option C. Assault. Option D. Battery. The correct answer is option D. Battery. Question 58. Which of the following is a reason for a medication aid to suspect a resident may be a victim of physical abuse? Option A. Skin tears on the forearm. Option B. Bruises in various stages of healing. Option C. Frequent crying or periods of sadness or withdrawal. Option D. Refusal of patient to see any visitors. The correct answer is option D. Refusal of patient to see any visitors. Question 59. Sharing information with others about the resident that could damage the resident's reputation is the definition of blank blank. Option A. Libel. Option B. Abuse. Option C. Neglect. Option D. Slander. The correct answer is option D. Slander. Question 60. Which of the following is an example of an ethical dilemma? Option A. Euthanasia. Option B. Slander. Option C. Abuse. Option D. Stealing. The correct answer is option A. Euthanasia. Question 61. On which part of the eye do cycloplegic eye drops work? Option A. Lashes. Option B. Muscles that control the lens. Option C. Sclera. Option D. Iris. The correct answer is option B. Muscles that control the lens. Question 62. Which of the following medications are prescribed for the symptoms of asthma? Option A. Inderal. Option B. Spiriva. Option C. Tusionex. Option D. Propranolol. The correct answer is option B. Spiriva. Question 63. Which of the following is an example of a trade name? Option A. Akopril. Option B. ACE inhibitor. Option C. Lisinopril. Option D. Quinapril. The correct answer is option A. Akopril. Question 64. When a drug's action changes a resident's response in a positive way, the drug is said to provide a blank blank. Option A. Therapeutic effect. Option B. A threshold effect. Option C. Dose-dependent effect. Option D. A drug action effect. The correct answer is option A. Therapeutic effect. Question 65. Which of the following definitions explains the metabolism of a medication? Option A. Decreases effect over time. Option B. An effect not anticipated. Option C. How the medication is used by the body. Option D. Disposal of the drug from the body. The correct answer is option C. How the medication is used by the body. Question 66. The nurse tells you that the blood level of a drug is too high. What do you know from that? Option A. The resident may be taking illegal drugs. Option B. The resident is at risk for toxicity. Option C. The rate of absorption of the drug is low. Option D. The rate of excretion for the drug is too high. The correct answer is option B. The resident is at risk for toxicity. Question 67. An example of a contraindication to giving a patient a particular medication is that the patient blank blank. Option A. Has taken the medication before. Option B. Has an allergy to the medication. Option C. Had an upset stomach the last time the medication was taken. Option D. Has diarrhea when taking the medication. The correct answer is option B, has an allergy to the medication. Question 68. Which of the following situations is life-threatening? Option A, allergic reaction. Option B, adverse drug reaction. Option C, idiosyncratic drug reaction. Option D, anaphylactic reaction. The correct answer is option D, anaphylactic reaction. Question 69. One of the residents assigned to the MACE complains of severe itching. You observe raised, irregular patches on the person's skin. This may be blank blank. Option A, measles. Option B, hives. Option C, cancer. Option D, a fungus. The correct answer is option B, hives. Question 70. When a person requires higher dosages of a medication to produce the same effects that once were achieved through lower dosages, this condition is called what? Option A, tolerance. Option B, dependence. Option C, a cumulative effect. Option D, a drug interaction. The correct answer is option A, tolerance. Question 71. Which of the following choices below is the best source for keeping up-to-date drug information? Option A, pharmacists. Option B, pharmacology books. Option C, drug pamphlets. Option D, electronic resources. The correct answer is option A, pharmacists. Question 72. Most drugs are excreted through blank blank. Option A, skin and sweat. Option B, lungs and saliva. Option C, liver and pancreas. Option D, urine and feces. The correct answer is option D, urine and feces. Question 73. A physician leaving a resident's room turns to the medication aide and says, "Please change Mrs. Smith's Tylenol to a rectal suppository instead of PO." What does the medication aide do then? Option A, quickly writes down the order on the MAR to be sure it is written correctly. Option B, tells the nurse the verbal order the physician just gave so that the nurse can write it in the chart. Option C, tells the physician that he or she cannot take verbal orders but that he or she will get the nurse. Option D, writes the order in the chart for the nurse to sign. The correct answer is option C, tells the physician that he or she cannot take verbal orders but that he or she will get the nurse. Question 74. As the medication aide is preparing to administer medications to a resident, it is noticed that pain medication is double the dose it was last time it was given. What is the best action for the medication aide? Option A, go ahead and give the medication because the resident has been having more pain lately. Option B, withhold the medication and let the next shift give if it is requested by the resident. Option C, ask the resident whether the dose is correct. Option D, bring the MAR to the nurse to check it against the physician's order. The correct answer is option D, bring the MAR to the nurse to check it against the physician's order. Question 75. 30 milliliters, ml, is equal to blank blank. Option A, 1 teaspoon. Option B, 2 tablespoons. Option C, 1 tablespoon. Option D, 2 teaspoons. The correct answer is option B, 2 tablespoons. Question 76. One of your residents complains of a headache, but he has no analgesic ordered. What then is the best course of action for the medication aide? Option A, give 2 Tylenol's tablets and tell the nurse that they have been administered. Option B, call the physician and get an order for an analgesic. Option C, tell the nurse about the resident's request for pain medication and that there is no updated order. Option D, give 2 Tylenol tablets and record as usual. The correct answer is option C, tell the nurse about the resident's request for pain medication and that there is no updated order. Question 77. Staff members store their lunches in the closest refrigerator, which also holds the medications that need to be kept at a certain temperature. What do you know as the medication aide? Option A, medications can be kept in any refrigerator. Option B, anything can be kept in the medication refrigerator as long as the temperature is constant. Option C, only specimens cannot be kept in the medication refrigerator. Option D, only medications can be kept in the medication refrigerator, and it must stay locked. The correct answer is option D, Only medications can be kept in the medication refrigerator, and it must stay locked. Question 78. For maximum absorption of a sublingual medication blank blank. Option A, it should be given with a full glass of water. Option B, the medication must be placed on the tip of tongue. Option C, the medication should be placed at the back of the tongue. Option D, no food or fluids until the medication is fully dissolved. The correct answer is option D, no food or fluids until the medication is fully dissolved. Question 79. To properly administer a liquid medication that is a suspension, it must be blank blank. Option A, shaken to thoroughly mix it. Option B, rolled gently between the palms of the hands to mix it. Option C, administered as is, no need to mix it. Option D, mixed with water from the faucet. The correct answer is option A, shaken to thoroughly mix it. Question 80. How should topical medications be given? Option A, intravenously. Option B, orally. Option C, via mucous membrane. Option D, by inhalation. The correct answer is option C, via mucous membrane. Question 81. How should medications ordered via inhalation be administered? Option A, by mouth. Option B, by breathing in. Option C, by placing on the skin. Option D, by injection. The correct answer is option B, by breathing in. Question 82. When the provider orders medications intravenously, it is given blank blank. Option A, by the nurse. Option B, by the nurse or the medication aide. Option C, only by the medication aide. Option D, by a family member. The correct answer is option A, by the nurse. Question 83. True or false, all side effects of medications are anaphylactic drug reactions. Option A, true. Option B, false. The correct answer is option B, false. Question 84. Which of the following is not a right of medication administration followed to prevent medication errors? Option A, right drug. Option B, right person. Option C, right size. Option D, right dose. The correct answer is option C, right size. Question 85. When is it not necessary to read a drug label? Option A, before giving the medication. Option B, after giving the medication. Option C, before pouring the medication. Option D, after removing the medication from the medication drawer. The correct answer is option B, after giving the medication. Question 86. Which of the following medications requires therapeutic blood levels of the drug to make sure the dose of the medication is not too high or too low? Option A, ASA. Option B, potassium. Option C, nitroglycerin. Option D, cardizem. The correct answer is option B, potassium. Question 87. Which of the following is a medication given to regulate the heart and requires blood levels? Option A, ASA. Option B, Lovenox. Option C, nitroglycerin. Option D, linoxin. The correct answer is option D, linoxin. Question 88. Which two identifiers are used to recognize a resident before giving a medication? Option A, room number and identification band. Option B, have the resident state his/her name and check the identification band. Option C, have the resident state his/her name and check the room number. Option D, check the identification band and check the bed number. The correct answer is option B, have the resident state his/her name and check the identification band. Question 89. The provider orders 5 mg of a medication. The medication is supplied as 10 mg in 10 ml. What quantity of medication will you give? Option A, 10 ml. Option B, 2.5 ml. Option C, 5 ml. Option D, 15 ml. The correct answer is option C, 5 ml. Question 90. What medication administration route has the slowest onset of action? Option A, intravenous. Option B, subcutaneous. Option C, oral. Option D, intramuscular. The correct answer is option C, oral. Question 91. Under which of the rights of medication administration do drug administration errors occur most frequently? Option A, right dose. Option B, right patient. Option C, right medication. Option D, right time. The correct answer is option A, right dose. Question 92. The resident in room 220 had trouble swallowing breakfast this morning. The medication aide's best course of action is to do blank blank. Option A, change the medication route to rectal instead of by mouth. Option B, give the medication slowly with ample water. Option C, hold the medication and tell the nurse of the resident's difficulty swallowing. Option D, call the provider to report the resident's difficulty swallowing. The correct answer is option C, hold the medication and tell the nurse of the resident's difficulty swallowing. Question 93. What is the best position to place the resident in to administer a vaginal medication? Option A, prone. Option B, lithotomy. Option C, left lateral recumbent. Option D, Sims. The correct answer is option B, lithotomy. Question 94. A rectal medication is inserted approximately blank blank into the rectum. Option A, 2 inches. Option B, 5 inches. Option C, 1/2 inch. Option D, 1 inch. The correct answer is option A, 2 inches. Question 95. Which of the following is an incorrect statement regarding the application of nitroglycerin cream? Option A, apply the medication to an area of the skin that is not open. Option B, rub the cream into the skin. Option C, do not place the medication on the same area of skin with each application. Option D, apply an accurate dose. The correct answer is option B, rub the cream into the skin. Question 96. When administering medication into the ear canal of an adult, it is important to do what? Option A, pull the pinna of the ear down and back. Option B, push the ear tragus forward. Option C, not touch the tragus of the ear. Option D, pull the pinna of the ear up and back. The correct answer is option D, pull the pinna of the ear up and back. Question 97. Instilling nasal medication requires the medication tech to position the patient with blank blank underscore. Option A, his/her neck hyperextended as able. Option B, lying on his/her back. Option C, Sims position. Option D, lying on his/her side. The correct answer is option A, his/her neck hyperextended as able. Question 98. Which of the following medications may be appropriate to crush for easier swallowing? Option A, Indral XL. Option B, contact time release capsule. Option C, enteric-coated aspirin. Option D, Tylenol. The correct answer is option D, Tylenol. Question 99. For the treatment of GERD, providers sometimes prescribe drugs that help move food faster through the esophagus and stomach. What are those drugs classified as? Option A, probiotics. Option B, antibiotics. Option C, prokinetics. Option D, hyperkinesias. The correct answer is option C, prokinetics. Question 100. Frequently used medication that may be kept in the medication room are commonly referred to as blank blank. Option A, unit dose. Option B, computerized dispensing system. Option C, stock med. Option D, community shared medication. The correct answer is option C, stock med. Question 101. For which of the following individuals would you withhold oral medications? Option A, a patient who has had a stroke and needs to have liquids thickened. Option B, a patient who is unconscious. Option C, a patient who is blind. Option D, a patient who is awake and alert and has no deficits. The correct answer is option B, a patient who is unconscious. Question 102. How long should a patient lie flat after you administer a rectal medication? Option A, 5 to 10 minutes. Option B, 15 to 20 minutes. Option C, 2 to 5 minutes. Option D, 0 to 2 minutes. The correct answer is option A, 5 to 10 minutes. Question 103. Antidysrhythmic medications are used to treat all of the following conditions except for blank blank. Option A, tachycardia. Option B, hypertension. Option C, irregular heartbeat. Option D, hyperlipidemia. The correct answer is option D, hyperlipidemia. Question 104. Which of the following conditions the patient needs to be observed closely when starting a patient on a beta blocker for hypertension? The medication aid knows that if the patient has option A, vascular hypertension, option B, asthma, option C, hyperlipidemia, option D, angina. The correct answer is option B, asthma. Question 105. By what system are nutrients and oxygen-rich blood transported to organs and tissues? Option A, urinary system. Option B, lymphatic system. Option C, cardiovascular system. Option D, pulmonary system. The correct answer is option C, cardiovascular system. Question 106. The blood pressure measures the amount of pressure on the arteries. With which of the following instruments can these sounds be heard? Option A, sphygmomanometer. Option B, stethoscope. Option C, cardiac monitor. Option D, defibrillator. The correct answer is option B, stethoscope. Question 107. For what do all statins, potent antilipemic medications, have all the following possible side effects except? Option A, muscle weakness. Option B, muscle soreness. Option C, diarrhea. Option D, anorexia. The correct answer is option C, diarrhea. Question 108. Which of the following medications is used with other antihypertensive medications to enhance their effect? Option A, ACE inhibitor. Option B, beta blocker. Option C, diuretic. Option D, calcium channel blocker. The correct answer is option C, diuretic. Question 109. Which of the following is not used to treat a patient with high cholesterol? Option A, Lipitor. Option B, Percentin. Option C, Mevacor. Option D, Pravachol. The correct answer is option B, Percentin. Question 110. Which of the following are two side effects of vasodilators such as nitroglycerin? Option A, headache and hypotension. Option B, dizziness and weakness. Option C, nausea and vomiting. Option D, anorexia and fatigue. The correct answer is option A, headache and hypotension. Question 111. Before giving a cardiac glycoside, which of the following does the medication aid need to know first about the patient? Option A, heart rate. Option B, blood pressure. Option C, temperature. Option D, pain level. The correct answer is option A, heart rate. Question 112. Which of the following statements shows that the medication aid needs more education about the medication Cardizem XL? Option A, hypotension can occur when taking the drug. Option B, the medication can be crushed if needed. Option C, this medication may decrease episodes of angina attacks. Option D, there are no difficulties in taking this medication and antacids at the same time. The correct answer is option B. The medication can be crushed if needed. Question 113. Which two expectorants are commonly used in the long-term care setting? Option A, Spiriva and Benadryl. Option B, Robitussin and SSKI. Option C, Atrovent and Preventil. Option D, Singular and Loratadine. The correct answer is option B, Robitussin and SSKI. Question 114. Singulair, Montelukast, is most often used with other medications to control asthma. What is the most important factor to remember when using Singulair? Option A, Singulair is not a fast-acting drug and cannot be used in the place of a rescue bronchodilator. Option B, it may reduce the use of a fast-acting bronchodilator over time. Option C, It may lead to fewer symptoms during the night. Option D. It may lead to fewer asthma attacks. The correct answer is option A. Singulair is not a fast-acting drug and cannot be used in the place of a rescue bronchodilator. Question 115. With which of the following medications can bronchospasms and COPD be effectively treated? Option A. Afrin. Option B. Zyrtec. Option C. Vicodin. Option D. Albuterol. The correct answer is option D. Albuterol. Question 116. Which of the following types of pneumonia results in damage to the surfactant level in the lungs? Option A. Viral. Option B. Bacterial. Option C. Primary. Option D. Aspiration. The correct answer is option D. Aspiration. Question 117. In asthma, the smooth muscles in the airways become severely constricted by an overstimulation from various sources, which may be either extrinsic or intrinsic. Which of the following is not an extrinsic source? Option A. Pollen. Option B. Cigarette smoke. Option C. Dust. Option D. Anxiety. The correct answer is option D. Anxiety. Question 118. Baking soda is commonly used by the elderly for heartburn. Which of the following is not a possible side effect of the medication? Option A. Edema. Option B. Alkalosis. Option C. Acidosis. Option D. Dehydration. The correct answer is option B. Alkalosis. Question 119. When a person has an antacid and other medications ordered, how should the antacid be administered? Option A. At the same time as the other medications to prevent GI upset. Option B. 30 minutes after the rest of the medication. Option C. 1 hour before or 2 hours after the rest of the medication. Option D. When the patient says he or she usually takes the antacid. The correct answer is option C. 1 hour before or 2 hours after the rest of the medication. Question 120. Which of the following is not a proton pump inhibitor? Option A. Acefex. Option B. Nexium. Option C. Pepcid. Option D. Prevacid. The correct answer is option C. Pepcid. Question 121. What is a side effect of most antiemetics that may lead to harm, especially for the elderly? Option A. Sedation. Option B. Dry mouth. Option C. Headache. Option D. Constipation. The correct answer is option A. Sedation. Question 122. A medication that makes food move more quickly through the GI tract is known as blank blank. Option A. PPI. Option B. H2 blocker. Option C. Antiemetic. Option D. Prokinetic. The correct answer is option D. Prokinetic. Question 123. Which of the following is not a risk factor for peptic ulcer disease, PUD? Option A. A family history of PUD. Option B. Stress. Option C. Smoking. Option D. Being a male. The correct answer is option D. Being a male. Question 124. When giving a patient a histamine blocker, it is important to watch for blank blank. Option A. Confusion. Option B. Weakness. Option C. Nausea. Option D. Hallucinations. The correct answer is option D. Hallucinations. Question 125. A patient reports to the medication aide that he or she is having black stools. After notifying the nurse, the medication aide examines the medication administration record. Which medication that may explain the black stools is taking the patient? Option A. Prilosec. Option B. Tagamet. Option C. Pepto-Bismol. Option D. Reglan. The correct answer is option C. Pepto-Bismol. Question 126. Laxatives are contraindicated in patients who have blank blank. Option A. Headaches. Option B. Severe constipation. Option C. PUD. Option D. Appendicitis. The correct answer is option D. appendicitis. Question 127. Question number 129. Topic 2. What is the correct adult dosage for lactulose? Option A, 1 teaspoon. Option B, 3 teaspoons. Option C, 2 teaspoons. Option D, a 1/2 teaspoon. The correct answer is option B, 3 teaspoons. Question 128. Which of the cells below creates antibodies to fight infection? Option A, erythrocytes. Option B, leukocytes. Option C, adipocytes. Option D, astrocytes. The correct answer is option B, leukocytes. Question 129. Which of the following routes is permissible for the medication Aide to administer immunizations? Option A, IM. Option B, SQ. Option C, PA. Option D, A4. The correct answer is option C, PA. Question 130. What is not a sign of infection? Option A, pink color. Option B, fever. Option C, cough. Option D, swollen glands. The correct answer is option A, pink color. Question 131. Which group below has the highest risk for infection? Option A, persons 5 to 10 years old. Option B, persons 30 to 50 years old. Option C, persons 18 to 29 years old. Option D, persons 80 years and over. The correct answer is option D, persons 80 years and over. Question 132. By which of these disease carriers are staph infections transmitted? Option A, hospitals. Option B, people. Option C, the furniture. Option D, equipment. The correct answer is option B, people. Question 133. Which of the following is an example of an antimicrobial medication that acts against gram-negative microbes? Option A, penicillin. Option B, deconazole. Option C, aminoglycoside. Option D, flagyl. The correct answer is option C, aminoglycoside. Question 134. What is the most effective antiviral for the flu? Option A, abacavir. Option B, acyclovir. Option C, amantadine hydrochloride. Option D, oseltamivir. The correct answer is option D, oseltamivir. Question 135. When a patient is receiving INH for active TB, how is it given? Option A, by itself. Option B, with rifampin. Option C, with myambutol. Option D, with Zithromax. The correct answer is option B, with rifampin. Question 136. All of the following are fungal infections except for blank blank. Option A, ringworm. Option B, athlete's foot. Option C, thrush. Option D, shingles. The correct answer is option D, shingles. Question 137. Which of the following medications is a macrolide? Option A, amoxicillin. Option B, Zithromax. Option C, Keflex. Option D, tetracycline. The correct answer is option B, Zithromax. Question 138. Which of the following is another term for urination? Option A, defecation. Option B, micturition. Option C, excretion. Option D, excision. The correct answer is option B, micturition. Question 139. The clearance of metabolic wastes is one of the most important functions of the kidney and is the most accurate measure of the health of which part of the kidney? Option A, tubules. Option B, urethra. Option C, nephrons. Option D, bladder. The correct answer is option C, nephrons. Question 140. Which of the following is the term for painful of difficult urination? Option A, dysuria. Option B, dynuria. Option C, polyuria. Option D, glycosuria. The correct answer is option A, dysuria. Question 141. Which of the medications below is prescribed for a urinary tract infection? Option A, Detrol. Option B, Etholitone. Option C, Diaryl. Option D, Bactrim DS. The correct answer is option D, Bactrim DS. Question 142. How long should the MACE observe client after an antibiotic is given for the first time? Option A, 5 minutes to assess any side effects. Option B, 10 minutes after the first dose is given. Option C, 20 minutes after the first dose is given. Option D, 20 to 30 minutes after the first dose and each dose following. The correct answer is option C, 20 minutes after the first dose is given. Question 143. Antispasmodic drugs help relieve the spasms by blocking parasympathetic activity and relaxing the detrusor and other urinary tract muscles involved in voiding. Which of the following are side effects of these medications? Option A, dry mouth. Option B, bradycardia. Option C, hypotension. Option D, diarrhea. The correct answer is option A, dry mouth. Question 144. What is the best time to administer a diuretic? Option A, before 6 a.m. Option B, after 10 p.m. Option C, between 8 a.m. and 10 a.m. Option D, at bedtime. The correct answer is option C, between 8 a.m. and 10 a.m. Question 145. True or false, clients receiving diuretic combination products are high risk for side effects specific to each drug? Option A, true. Option B, false. The correct answer is option A, true. Question 146. Which of the following are the electrolytes most affected by combination diuretics? Option A, potassium and sodium. Option B, calcium and magnesium. Option C, sodium and magnesium. Option D, calcium and potassium. The correct answer is option A, potassium and sodium. Question 147. All of the following are loop diuretics except blank blank. Option A, Bumex. Option B, Lasix. Option C, Didicrin. Option D, Diaryl. The correct answer is option D, Diaryl. Question 148. Bones store almost 100% of the body's calcium. Which of the following hormones aids in the storage of calcium? Option A, testosterone. Option B, estrogen. Option C, progesterone. Option D, insulin. The correct answer is option B, estrogen. Question 149. When given with calcium, which of the following supplements increases the body's absorption of the calcium? Option A, vitamin D. Option B, vitamin C. Option C, vitamin A. Option D, vitamin E. The correct answer is option A, vitamin D. Question 150. Muscle relaxants can cause all of the following effects except for blank blank. Option A, sedation. Option B, depression. Option C, urinary urgency. Option D, hyperactivity. The correct answer is option D, hyperactivity. Question 151. NSAIDs should be given with blank blank. Option A, water, and at least 30 minutes before other medications. Option B, water, and can be given with other medications. Option C, food. Option D, water and food without restrictions. The correct answer is option C, food. Question 152. Which of the following effects can be attributed to long-term prednisone treatment? Option A, blurry vision. Option B, dry skin. Option C, thin skin. Option D, loss of hearing. The correct answer is option C, thin skin. Question 153. The MACE may be responsible for administering a medication to improve bone density. Which of the following side effect is most common side effect of the medication Bonneva? Option A, GI upset. Option B, pain in arms or legs. Option C, weakness. Option D, jaw discomfort. The correct answer is option B, pain in arms or legs. Question 154. Of the following factors, all can lead to osteoporosis except for blank blank. Option A. A mild but prolonged lack of calcium. Option B. A hormonal imbalance to an endocrine disorder. Option C. An increase in estrogen. Option D. A sedentary lifestyle. The correct answer is option C. An increase in estrogen. Question 155. Which of the following diseases are used to treat with allopurinol? Option A. Arthritis. Option B. Gout. Option C. Rheumatoid arthritis. Option D. Muscle spasms. The correct answer is option B. Gout. Question 156. Which of the following is a serious side effect of NSAIDs? Option A. GI bleed. Option B. GI upset. Option C. Constipation. Option D. Frequent urination. The correct answer is option A. GI bleed. Question 157. The goal in treating osteoporosis includes all of the following reasons except for blank blank. Option A. Control bone loss. Option B. Prevent fractures. Option C. Control pain. Option D. Produce new bone. The correct answer is option C. Control pain. Question 158. Anticholinergic drugs can cause drowsiness because of their effect on blank blank system. Option A. Cardiovascular. Option B. Respiratory. Option C. Central nervous system. Option D. Peripheral vascular system. The correct answer is option C. Central nervous system. Question 159. Residents who have asthma and receive beta blockers should be closely monitored for blank blank adverse effect. Option A. Febrile response. Option B. Bronchial constriction. Option C. Hypertension. Option D. Tachycardia. The correct answer is option B. Bronchial constriction. Question 160. Which of the following medications is an alpha-1 adrenergic receptor? Option A. Preventil. Option B. Dalupant. Option C. Bredhine. Option D. Neosynephrine. The correct answer is option C. Bredhine. Question 161. Anticholinergics are given to treat all of the following conditions except for blank blank. Option A. Irritable bowel disease. Option B. Urinary retention. Option C. Parkinson disease. Option D. COPD. The correct answer is option B. Urinary retention. Question 162. Which of the following are side effects of anticholinergic medications? Option A. Dry mouth and urinary retention. Option B. Excessive thirst and hunger. Option C. Urinary urgency and excessive salvia. Option D. Bradycardia and dizziness. The correct answer is option A. Dry mouth and urinary retention. Question 163. Sedative hypnotic drugs are used to help clients to blank blank. Option A. Stay alert. Option B. Reduce hyperactivity. Option C. Wake up. Option D. Fall asleep. The correct answer is option D. Fall asleep. Question 164. True or false, sedative hypnotic medications are Schedule II drugs? Option A. True. Option B. False. The correct answer is option A. True. Question 165. Benzodiazepines are short-acting sedative hypnotics. Which of the following is a benzodiazepine? Option A. Diazepam. Option B. Percodan. Option C. Ultram. Option D. Oxycodone. The correct answer is option A. Diazepam. Question 166. What is the one side effect of an anti-Parkinson's medication? Option A. Blurred vision. Option B. Rapid involuntary movement. Option C. Skin discoloration. Option D. Rapid weight loss. The correct answer is option B. Rapid involuntary movement. Question 167. A reduction in blank blank causes the symptoms of Parkinson's disease. What is the correct substance? Option A. Dopamine. Option B, dobutamine. Option C, serotonin. Option D, norepinephrine. The correct answer is option A, dopamine. Question 168. Which of the following types of diabetes occurs more frequently in older persons? Option A, gestational. Option B, diabetes 1. Option C, diabetes 2. Option D, juvenile diabetes. The correct answer is option C, diabetes 2. Question 169. Which of the following do hyperglycemia symptoms include? Option A, diarrhea. Option B, shaking. Option C, diaphoresis. Option D, excessive thirst. The correct answer is option D, excessive thirst. Question 170. A goiter is found on blank blank. Option A, spleen. Option B, liver. Option C, thyroid. Option D, gallbladder. The correct answer is option C, thyroid. Question 171. Insulin is administered by which route? Option A, intravenously. Option B, subcutaneously. Option C, intramuscularly. Option D, orally. The correct answer is option B, subcutaneously. Question 172. Which of the following is not a sign of hypoglycemia? Option A, hyperactivity. Option B, shakiness. Option C, diaphoresis. Option D, excessive thirst. The correct answer is option D, excessive thirst. Question 173. What is the correct definition of hypoglycemia? Option A, too much glucose in the blood. Option B, too much sodium in the blood. Option C, too little sodium in the blood. Option D, too little glucose in the blood. The correct answer is option D, too little glucose in the blood. Question 174. All of the following except for blank blank are medications for hypothyroidism. Option A, propylthiouracil. Option B, cytomel. Option C, synthroid. Option D, thyrolar 1. The correct answer is option A, propylthiouracil. Question 175. What should a medication aide do if he or she is asked by the nurse to give insulin? Option A, draw up the correct amount of insulin and administer it as directed. Option B, decline the delegation given by the nurse. Option C, check the medication administration and prepare the medication for the nurse to administer. Option D, make sure that he or she is familiar with the procedure before administering the medication. The correct answer is option B, decline the delegation given by the nurse. Question 176. Which of the following is not a sulfonylurea medication used to treat hyperglycemia in type 2 diabetes? Option A, diabenese. Option B, glinase. Option C, guaranase. Option D, glucotrol. The correct answer is option B, glinase. Question 177. When the TZD should be administered, given the fact that the main side effect of a TZD is hypoglycemia? Option A, 30 minutes to 60 minutes before a meal. Option B, less than 90 minutes after a meal. Option C, less than 30 minutes before a meal. Option D, more than 30 minutes after a meal. The correct answer is option C, less than 30 minutes before a meal. Question 178. How long should you wait between the first and second medications when giving two eye medications at the same time? Option A, 1 minute. Option B, 3 minutes. Option C, 5 minutes. Option D, 10 minutes. The correct answer is option D, 10 minutes. Question 179. Which of the following statements is false when administering eye medications? Option A, follow the 6 rights of medication administration. Option B, place medication directly on the conjunctiva. Option C, touch the tip of tubes or other eye drop containers to the eye. Option D, do not use the same ophthalmic ointment on another client. The correct answer is option C, touch the tip of tubes or other eye drop containers to the eye. Question 180. A resident is taking Cosopt and has tachycardia and nervousness. You are responsible for blank blank. Option A, documenting the symptoms. Option B, calling the doctor. Option C, telling the nurse. Option D, telling a family member. The correct answer is option C, telling the nurse. Question 181. What is a fluoromethylone? Option A, fluoroquinolone. Option B, corticosteroid. Option C, bacteriostatic. Option D, bactericidal. The correct answer is option B, corticosteroid. Question 182. What timolol 0.5% is used for? Option A, open-angle glaucoma. Option B, eye infections. Option C, eye inflammation. Option D, eye redness. The correct answer is option A, open-angle glaucoma. Question 183. How ophthalmic drugs are used? Option A, in the ears. Option B, in the eyes. Option C, in the nose. Option D, in the mouth. The correct answer is option B, in the eyes. Question 184. How otic drugs are used? Option A, in the ears. Option B, in the eyes. Option C, in the nose. Option D, in the mouth. The correct answer is option A, in the ears. Question 185. When giving ear drops, do all of the following except blank blank. Option A, follow the 6 rights of medication administration. Option B, after checking with the nurse, gently wipe the ear with a cotton tip if cerumen is blocking the canal. Option C, position the client in the side-lying position. Option D, disregard any redness or irritation at the site. The correct answer is option D, disregard any redness or irritation at the site. Question 186. What do you do to administer ear medication to an adult? Option A, pull the ear down and out. Option B, pull the ear back and upward. Option C, push the tragus open. Option D, do not touch the ear while giving the medication. The correct answer is option B, pull the ear back and upward. Question 187. Which of the following medications is effective for ear fungal infections? Option A, corticosporin. Option B, nystatin. Option C, cerumenex. Option D, herplex. The correct answer is option B, nystatin. Question 188. Signs of cancer in the body include all of the following except blank blank. Option A, weight gain and increased energy. Option B, change in bowel or bladder habits. Option C, unusual bleeding or discharge. Option D, change in a mole or sore. The correct answer is option A, weight gain and increased energy. Question 189. Drugs used to treat cancers are called blank blank. Option A, antivenin drugs. Option B, antineoplastic drugs. Option C, antibiotics. Option D, antifungal drugs. The correct answer is option B, antineoplastic drugs. Question 190. Chemotherapeutic medications have some similar side effects. Which of the following would be considered a serious, fatal, side effect? Option A, alopecia. Option B, stomatitis. Option C, anorexia. Option D, leukopenia. The correct answer is option D, leukopenia. Question 191. What are the normal age-related changes that make older clients more at risk for infections? Option A, age-related changes in the immune system. Option B, increased renal and liver function. Option C, decreased susceptibility to the CNS. Option D, fewer problems with gastrointestinal effects. The correct answer is option A, age-related changes in the immune system. Question 192. Which of the following chemotherapeutic drugs is an alkylating agent? Option A, cisplatin. Option B, 5-FU. Option C, oncovin. Option D, ethinyl estradiol. The correct answer is option A, Cisplatin. Question 193. Chemotherapeutic medications that replace the cancer-causing metabolites with different cells and prevent continued cell growth are known as blank blank. Option A, alkylating agents. Option B, hormone agents. Option C, antimetabolites. Option D, mitotic inhibitors. The correct answer is option C, antimetabolites. Question 194. Which of the following medications is not a nasal decongestant? Option A, pseudoephedrine. Option B, loratadine. Option C, epinephrine. Option D, phenylephrine. The correct answer is option B, loratadine. Question 195. Which of the following is not a hormone used as a chemotherapeutic agent? Option A, tamoxifen. Option B, estradiol. Option C, a thyroid-stimulating hormone. Option D, abaralex. The correct answer is option C, thyroid-stimulating hormone. Question 196. Which of the following medications are cell cycle-specific agents that slow DNA synthesis? Option A, alkylating agents. Option B, hormone agents. Option C, antimetabolites. Option D, mitotic inhibitors. The correct answer is option D, mitotic inhibitors. Question 197. What does the term carcinogenic mean? Option A, causing death. Option B, cancer causing. Option C, genetically predisposed to cancer. Option D, having past history of cancer. The correct answer is option B, cancer causing. Question 198. Which of the following medications is not a benzodiazepine? Option A, chlordiazepoxide. Option B, lorazepam. Option C, citalopram. Option D, valprazolam. The correct answer is option C, citalopram. Question 199. The resident is started on an antidepressant. For which potential side effect should the resident be assessed in the first 2 to 4 weeks? Option A, weakness. Option B, increased libido. Option C, a hangover effect. Option D, suicidal tendencies. The correct answer is option D, suicidal tendencies. Question 200. Which words best help the MACE to understand the meaning of the term mental illness? Option A, brain damaged. Option B, a disease of the brain with behavioral symptoms. Option C, dangerous behavior. Option D, a person who has seizures. The correct answer is option B, a disease of the brain with behavioral symptoms. Question 201. All of the following are symptoms of anxiety except blank blank. Option A, increased appetite. Option B, dry mouth. Option C, nausea. Option D, sleep problems. The correct answer is option A, increased appetite. Question 202. Bradykinesia and tardive dyskinesia are of particular interest to which group of CNS medications? Option A, benzodiazepines. Option B, neuroleptics. Option C, antipsychotic agents. Option D, antidepressants. The correct answer is option C, antipsychotic agents. Question 203. Which side effect below is not due to taking tricyclic antidepressants? Option A, constipation. Option B, incontinence. Option C, CNS effects. Option D, cardiac dysrhythmias. The correct answer is option B, incontinence. Question 204. Many of CNS medications should be taken at night, before bed, to avoid blank blank. Option A, dizziness. Option B, blurred vision. Option C, sedation. Option D, confusion. The correct answer is option C, sedation. Question 205. Which choice would be a dangerous side effect for a resident receiving Abilify? Option A, chest pain. Option B, dry mouth. Option C, weight loss. Option D, dizziness. The correct answer is option A, chest pain. Question 206. True or false, it is important for antipsychotic medications to be administered close to the same time every day. Option A, true. Option B, false. The correct answer is option A, true. Question 207. When a resident is taking a CNS medication, he or she must avoid blank blank. Option A, eating vegetables. Option B, eating all fruits. Option C, drinking carbonated beverages. Option D, drinking alcohol. The correct answer is option D, drinking alcohol. Question 208. What is the best way to verify a provider's eligible order? Option A. Ask a fellow medication aide to verify the order. Option B. Ask the pharmacist what he/she thinks the provider's means. Option C. Call the provider to verify the order. Option D. Compare the writing to other orders that the provider has written. The correct answer is option C. Call the provider to verify the order. Question 209. A resident is scheduled to receive oral ibuprofen for chronic arthritic pain. However, the resident is unable to swallow. The nurse must be informed because this is a problem with which of the following rights of medication administration? Option A. The right time. Option B. The right dose. Option C. The right route. Option D. The right medication. The correct answer is option C. The right route. Question 210. What would be the medication aid response when he/she is asked by a resident about how medications work when taken into the body? Option A. Medications can cause the growth of abnormal cells. Option B. Medications enhance or block some functions of the body. Option C. Medications can change the function of some of the cells of the body. Option D. Medications can cause the body to develop new cells. The correct answer is option B. Medications enhance or block some functions of the body. Question 211. What is the best action for a medication aide who is administering medication to an alert and competent resident who refuses to take his/her medication as directed? Option A. Realize the resident has the right to refuse medications. Option B. Attempt to talk the resident into taking his/her medication by telling him/her how much better he/she will feel if he/she takes it. Option C. Let the resident know you will return to see whether he/she will be ready to take the medication in a few minutes. Option D. Explain to the resident that his/her loved ones want him/her to take the medication so that he/she can get better. The correct answer is option A. Realize the resident has the right to refuse medications. Question 212. Which of the following may be a cause for a medication's failure to elicit the desired effect? Option A. The resident's past history of drug abuse. Option B. Using the generic form instead of the brand name medication. Option C. The resident's diet and nutritional status. Option D. Provider orders for several different medications for the resident. The correct answer is option C. The resident's diet and nutritional status. Question 213. What does the term polypharmacy mean? Option A. The resident takes many different medications for various medical conditions. Option B. The resident or a family member obtains the resident's medications from several different pharmacies. Option C. The resident is able to take many different medications without any adverse effects. Option D. The resident takes the same medication several times a day. The correct answer is option A. The resident takes many different medications for various medical conditions. Question 214. Which of the following questions is open-ended? Option A. Are you allergic to aspirin? Option B. Have you ever taken aspirin before? Option C. When you took the aspirin, did you have a reaction? Option D. What medications are you allergic to? The correct answer is option D. What medications are you allergic to? Question 215. A resident is taking Coumadin and enjoys eating green leafy vegetables. Which type of interaction is considered the response of Coumadin to green leafy vegetables? Option A. Food. Option B. Bioavailability. Option C. Additive. Option D. Polymorphism. The correct answer is option A. Food. Question 216. Which complaint by a resident would indicate an adverse effect to aspirin? Option A, stomach upset. Option B, increased red blood cell count. Option C, ringing in the ears. Option D, headaches. The correct answer is option C, ringing in the ears. Question 217. Which of the following would be considered a side effect of a medication? Option A, lips and tongue feeling numb. Option B, irregular heartbeat. Option C, ringing in the ears. Option D, nausea. The correct answer is option D, nausea. Question 218. Which is a statement is an example of a drug error? Option A. A person refuses to take their meds because they are feeling sick. Option B. A person is using the bathroom and asks you to come back in a few minutes. Option C. A person is out with family and took their meds with them. Option D. A person went to a DR appointment and got back too late to take their meds. The correct answer is option D. A person went to a DR appointment and got back too late to take their meds. Question 219. You are getting ready to go into a resident's room to administer their meds. The drug cart keys should be kept with you while you care in the room. Option A, kept in the med cart while you are in the room. Option C, given to the nurse while you are in the room. Option D, given to the unit clerk while in the room. The correct answer is option B, NaN. Question 220. The correct dose of a medication is option A, the dosage that is sent by the pharmacy. Option B, the dosage of the drug listed in the order. Option C, the amount of drug in a unit dose packet. Option D, the amount person says they are taking. The correct answer is option B, the dosage of the drug listed in the order. Question 221. How the drug enters the body is referred to as the right. Option A, dose. Option B, route. Option C, technique. Option D, patient. The correct answer is option B, route. Question 222. Antagonism is option A, when two drugs are given and one drug increases the effect of the other drug. Option B, an unusual or abnormal response to the drug that some people may have. Option C, an unfavorable response to a substance that causes a hypersensitivity reaction. Option D, a drug interaction in which two drugs inhibit or cancel out the effects of the other. The correct answer is option D, a drug interaction in which two drugs inhibit or cancel out the effects of the other. Question 223. There are several systems involved in keeping medication administration safe. One way is the system of checking the order and the med while you are preparing the meds. How many safety checks are done during this time? Option A, 1. Option B, 2. Option C, 3. Option D, 4. The correct answer is option C, 3. Question 224. To prevent infections while passing medications you should. Option A, wash hands before giving drugs. Option B, practice hand hygiene. Option C, wear gloves at all times during med pass. Option D, practice hand hygiene before and after giving drugs. The correct answer is option D, practice hand hygiene before and after giving drugs. Question 225. 1 teaspoon equals. Option A, 2 milliliters. Option B, 2.5 milliliters. Option C, 5 milliliters. Option D, 10 milliliters. The correct answer is option C, 5 milliliters. Question 226. Your patient has tablets and cough syrup to take. When giving these meds at the same time, how it is done? Option A, pour cough syrup into the water for the patient to drink their meds. Option B, crush and mix meds including the cough syrup together. Option C, give cough syrup last after they have taken other meds. Option D, give the cough syrup last but then give a drink of water afterwards. The correct answer is option C, give cough syrup last after they have taken other meds. Question 227. You are giving a med B the buccal root. You know the med is. Option A, placed under the tongue. Option B, chewed and swallowed. Option C, crush and mixed with applesauce. Option D, placed between the cheek and the gums. The correct answer is option D, placed between the cheek and the gums. Question 228. To apply a transdermal patch you will: Option A, cover the new patch with a transparent dressing. Option B, remove old patch before applying the new one. Option C, apply the new patch before removing old one. Option D, place the new patch directly onto the area the old one was. The correct answer is option B, remove old patch before applying the new one. Question 229. Check order for medication contains in the abbreviation that you do not know. What do you do? Option A, check the drug book first. Option B, give the med and check with the nurse to verify the drug order. Option C, hold the med and check with the nurse to verify the drug order. Option D, document that the drug was not given because the med orders were not clear. The correct answer is option C, hold the med and check with the nurse to verify the drug order. Question 230. After eye ointment is applied, you instruct the person to: Option A, close the eye and gently rub to a circular motion. Option B, keep the eye open and move the eyes up and down. Option C, close the eyes tightly and rub excess meds out. Option D, stare straight ahead to help it to be absorbed. The correct answer is option A, close the eye and gently rub to a circular motion. Question 231. Potentiation is: Option A, when two drugs given together and one drug increase the effect of the other drug. Option B, an unusual or abnormal response to the drug that some people may have. Option C, an unfavorable response to a substance that causes hypersensitivity reaction. Option D, a term that describes when a drug can become poison in the body. The correct answer is option A, when two drugs given together and one drug increase the effect of the other drug. Question 232. When education a person who is aboard spectrum antibiotics, the CMA would include: Option A, signs and symptoms of fungal infections and how to prevent this. Option B, being aware of orthostatic hypotension and use of the call bell for assistance. Option C, the inflated cost of the drug and alternatives that may be available. Option D, how the drug also combats viral infections such as the flu and common cold. The correct answer is option A, signs and symptoms of fungal infections and how to prevent this. Question 233. An idiosyncratic reaction is: Option A, when two drugs given together and one drug increase the effect of the other drug. Option B, an unusual and abnormal response to the drug that some people may have. Option C, an unfavorable response to a substance that causes hypersensitivity reaction. Option D, a drug interaction in which two drugs inhibit or cancel out the effects of the other. The correct answer is option B, an unusual and abnormal response to the drug that some people may have. Question 234. Drugs are excreted mainly through the: Option A, heart and lungs. Option B, urine and feces. Option C, breast milk. Option D, skin and saliva. The correct answer is option B, urine and feces. Question 235. What oral drug form may be crushed? Option A, timed releases tablets. Option B, enteric-coated tablets. Option C, sublingual tablets. Option D, caplets. The correct answer is option D, caplets. Question 236. Non-parenteral meds. Option A, do not require DR note to give. Option B, are topicals such as creams, pastes, and inhalers. Option C, enter the body through a route other than injection. Option D, enter the body by injection such as IM, sub-Q or 4. The correct answer is option C, enter the body through a route other than injection. Question 237. The topical medication used to treat thrush is A/N. Option A, antipyretic. Option B, pediculicide. Option C, antifungal. Option D, antiviral. The correct answer is option C, antifungal. Question 238. What does anti-hyperuricemics treat? Gout. When a resident is taking an expectorant, it is important for them to also increase blank blank. Option A, fluid intake. Option B, food intake. Option C, fiber intake. Option D, activity. The correct answer is option A, fluid intake. Question 239. Which of the following H2 receptor blockers can interfere with the effect of many classifications of medications? Option A, cimetidine. Option B, famotidine. Option C, nizatidine. Option D, ranitidine. The correct answer is option A, cimetidine. Question 240. Which of the following medications is prescribed for hypothyroidism? Option A, Synthroid. Option B, Ginderil. Option C, metformin. Option D, Synmet. The correct answer is option A, Synthroid. Question 241. In which of the following ways do bronchodilators work? Option A, open airways by constricting smooth muscles in the bronchial tree. Option B, decreases rhinorrhea. Option C, decreases cough and clears airway. Option D, open airways by dilating smooth muscles in the bronchial tree. The correct answer is option D, open airways by dilating smooth muscles in the bronchial tree. Question 242. To which class of medication does verapamil belong? Option A, calcium channel blocker. Option B, beta blocker. Option C, ACE inhibitor. Option D, ARBs. The correct answer is option A, calcium channel blocker. Question 243. The medication aide's responsibilities include all of the following except blank blank. Option A, carries out delegated nursing tasks. Option B, performs direct care to residents without supervision. Option C, recognizes and performs tasks according to level of education and training. Option D, accepts responsibility and accountability for own performance according to state laws and regulations regarding medication aides. The correct answer is option B, performs direct care to residents without supervision. Question 244. Furosemide is a blank blank for a commonly prescribed diuretic. Option A, trade name. Option B, chemical name. Option C, generic name. Option D, popular name. The correct answer is option C, generic name. Question 245. It is necessary to wash hands in all of the following situations except blank blank. Option A, when the hands become visibly soiled. Option B, before administering medications. Option C, after removing gloves. Option D, when arriving at work. The correct answer is option D, when arriving at work. Question 246. Gloves should be worn when blank blank. Option A, giving oral medication. Option B, coming into contact with body fluids. Option C, entering a resident's room. Option D, collecting the trash. The correct answer is option B, coming into contact with body fluids. Question 247. After the resident has inhaled his/her dose of Preventil, the next step is to have him/her blank blank. Option A, rinse out his/her mouth with water. Option B, hold in the medication for as long as possible. Option C, breath out as hard and fast as he/she can. Option D, none of the above. The correct answer is option B, hold in the medication for as long as possible. Question 248. Which of the following medications belongs in the classification of an antibiotic? Option A, 5-FU. Option B, chlorpromazine. Option C, Valium. Option D, Bactrim DS. The correct answer is option D, Bactrim DS. Question 249. Requiring more of a medication to feel good or to be able to carry out daily activities is called blank blank. Option A, tolerance. Option B, dependence. Option C, cumulative effect. Option D, a drug interaction. The correct answer is option B, dependence. Question 250. What is the best source for the medication aid when checking for drug information? Option A, newspaper. Option B, a fellow medication aid. Option C, a pharmacist. Option D, the patient. The correct answer is option C, a pharmacist. Question 251. Which is the fastest absorption of medication? Option A, through the skin. Option B, through the muscle. Option C, through the veins. Option D, through the stomach. The correct answer is option C, through the veins. Question 252. Some medications to treat cancer are classified as antineoplastic. Which of the following medications is an antineoplastic medication? Option A, Prilosec. Option B, 5-FU. Option C, ampicillin. Option D, cardizem. The correct answer is option B, 5-FU. Question 253. Which of the following is an appropriate action when administering ear drops? Option A, keep the medication in the refrigerator until just before administering it. Option B, have the person lie on his or her side for 15 to 20 minutes. Option C, place an earwick in the affected ear for greater absorption. Option D, administer the medication only to the ear it is prescribed. The correct answer is option D, administer the medication only to the ear it is prescribed. Question 254. For which of the following patients would you withhold oral medications? Option A, a patient who has had a stroke and needs to have liquids thickened. Option B, a patient who is unconscious. Option C, a patient who is blind. Option D, a patient who is awake and alert and has no deficits. The correct answer is option B, a patient who is unconscious. Question 255. Which of the following medications would be prescribed for anxiety? Option A, Inderal. Option B, Lasix. Option C, Valium. Option D, Celebrex. The correct answer is option C, Valium. Question 256. Which of the following medications is used as an antihypertensive medications? Option A, ACE inhibitor. Option B, NSAIDs. Option C, Xanax. Option D, calcium. The correct answer is option A, ACE inhibitor. Question 257. What should the medication aid wear when administering transdermal nitroglycerin patches? Option A, eye protection. Option B, gloves. Option C, gown and gloves. Option D, eye protection, gown, and gloves. The correct answer is option B, gloves. Question 258. Which of the following are side effects of nitroglycerin? Option A, headache. Option B, vertigo. Option C, vomiting. Option D, anorexia. The correct answer is option A, headache. Question 259. Which of the following is an expectorant? Option A, Spiriva. Option B, Benadryl. Option C, loratadine. Option D, guaifenesin. The correct answer is option D, guaifenesin. Question 260. A resident is ordered ferrous sulfate 325 mg 3 times a day for anemia. Which of the following things about administering the medication is it important for the medication aid to know? Option A, give with milk. Option B, administer on an empty stomach. Option C, give with orange juice. Option D, allow the resident to take with other medications. The correct answer is option C, give with orange juice. Question 261. Which of the following include common side effects of nitrates? Option A, headache, flushing, postural hypotension. Option B, blurred vision and dry mouth. Option C, weight gain or worsening CHF. Option D, dizziness. The correct answer is option A, headache, flushing, postural hypotension. Question 262. HMG-CoA inhibitors belong to a class of medications known as statins. Statins are known for at least one serious adverse effect on blank major system. Option A, cardiovascular. Option B, respiratory. Option C, musculoskeletal. Option D, gastrointestinal. The correct answer is option C, musculoskeletal. Question 263. Before giving metoprolol, the medication aide should know if the resident has a history of blank blank. Option A, headaches. Option B, bronchospasms. Option C, angina. Option D, constipation. The correct answer is option B, bronchospasms. Question 264. A resident has been ordered Synthroid and wants to know what it is prescribed for. What is the correct answer? Option A, hypothyroidism. Option B, hypertension. Option C, hyperthyroidism. Option D, hypotension. The correct answer is option A, hypothyroidism. Question 265. Which of the following is a serious adverse effect of Synthroid? Option A, tachycardia. Option B, malignant hyperthermia. Option C, fatigue. Option D, hypotension. The correct answer is option A, tachycardia. Question 266. A resident is taking metformin. The medication aide knows this medication is taken for blank blank. Option A, diabetes mellitus type 1. Option B, diabetes mellitus type 2. Option C, diabetes insipidus. Option D, hypothyroidism. The correct answer is option B, diabetes mellitus type 2. Question 267. If a resident is to have a test that utilizes dye, which medication must be withheld for 24 hours before and 48 hours after the test? Option A, Starlit. Option B, Precoz. Option C, Actose. Option D, Glucophage. The correct answer is option D, Glucophage. Question 268. The medication aide explains to a resident's family member that the most effective treatment for acne is blank blank. Option A, soap and water. Option B, cryotherapy. Option C, dietary restrictions. Option D, the stringent medication. The correct answer is option D, astringent medication. Question 269. Which of the following medications is used for fast relief from increased wheezing and shortness of breath for a resident who suffers from asthma? Option A, aminophylline. Option B, Dasmacort. Option C, Preventil. Option D, Spiriva. The correct answer is option C, Preventil. Question 270. Which of the following is the generic name for Zithromax? Option A, clarithromycin. Option B, azithromycin. Option C, erythromycin. Option D, boxamycin. The correct answer is option B, azithromycin. Question 271. What is the most common side effect of acyclovir? Option A, hypertension. Option B, tachycardia. Option C, bradycardia. Option D, headache. The correct answer is option A, hypertension. Question 272. When can an MACE refuse an assignment? Option A, when it is almost time for his or her shift to end. Option B, when he or she is too busy. Option C, when the task is unclear. Option D, when the nurse is not busy. The correct answer is option C, when the task is unclear. Question 273. Every new resident of an extended care facility should be provided a copy of blank blank publication. Option A, the rights of the state agency. Option B, the rules and regulations for residents. Option C, the patient's bill of rights. Option D, the resident's bill of rights. The correct answer is option D, the resident's bill of rights. Question 274. The MACE is responsible for knowing the medical information of blank blank. Option A, all residents at the MACE's place of employment. Option B, each of the residents he/she is assigned to. Option C, all residents on his/her unit or floor. Option D, all residents assigned to his/her supervising nurse. The correct answer is option B, each of the residents she is assigned to. Question 275. The MACE is administering guaifenesin to a resident as part of the resident's treatment for the flu. Which of the following responses would the MACE see that would demonstrate the effectiveness of the treatment? Option A. The resident becomes afebrile. Option B. The resident sleeps through the night. Option C. The resident's cough is looser and productive. Option D. The resident experiences a decrease in coughing. The correct answer is option C. The resident's cough is looser and productive. Question 276. The MACE knows the correct method for preparing to administer a metered dose inhaled respiratory medication is blank blank. Option A. Shake the medication container. Option B. Do not shake but roll the medication container in the palms of the hands until well mixed. Option C. Set the medication out at room temperature until it reaches body temperature. Option D. Do not shake or roll the medication container before administering. The correct answer is option A. Shake the medication container. Question 277. Which statement is a benefit of an oral decongestant? Option A. Less chance of rebound congestion. Option B. Higher potency. Option C. Longer acting. Option D. Taste better. The correct answer is option A. Less chance of rebound congestion. Question 278. Which of the following medications is given for a bacterial infection? Option A. Proscar. Option B. Flagyl. Option C. Cardizem. Option D. Tetracycline. The correct answer is option D. Tetracycline. Question 279. The MACE knows that it is not appropriate to blank blank when taking an antibiotic. Option A. Stop the medication when symptoms clear. Option B. Take the medication until the medication is gone. Option C. Drink plenty of fluids. Option D. Follow standard precautions. The correct answer is option A. Stop the medication when symptoms clear. Question 280. Which of the following foods should avoid a resident who is taking a Clercon, potassium replacement? Option A. Apples. Option B. Grapefruit. Option C. Tomatoes. Option D. Bananas. The correct answer is option D. Bananas. Question 281. Many older individuals have used baking soda as a home remedy for indigestion. Baking soda should not be taken if the resident has blank blank. Option A. Congestive heart failure. Option B. Renal disease. Option C. Osteoporosis. Option D. Hypertension. The correct answer is option C. Osteoporosis. Question 282. Residents who are taking PPI should only take them for the following durations. Option A. Until symptoms subside. Option B. For as long as they are affordable. Option C. After they have eaten a bland diet for 2 weeks. Option D. Until discontinued by their healthcare provider. The correct answer is option D. Until discontinued by their healthcare provider. Question 283. When should Carafate be administered? Option A. At least 1 hour before meals on an empty stomach. Option B. At least 1 hour after meals on a full stomach. Option C. With meals when food is in the stomach. Option D. With fluids just before the meal. The correct answer is option A. At least 1 hour before meals on an empty stomach. Question 284. What is the maximum dose of Tylenol in 24 hours? Option A. 3 grams. Option B. 6 grams. Option C. 1 gram. Option D. 2 grams. The correct answer is option A. 3 grams. Question 285. Tramadol is a non-narcotic centrally acting analgesic. Which of the following is the most serious adverse effect listed that may occur when taken? Option A. Excessive hunger. Option B. GI bleeding. Option C. Seizures. Option D. Nervousness. The correct answer is option C. Seizures. Question 286. Which of following forms of medication can be cut in half? Option A. Non-scored tablet. Option B, caplet. Option C, capsule. Option D, scored tablet. The correct answer is option D, scored tablet. Question 287. Fall precaution is important for residents taking anticonvulsant medications. Which of the medications is an anticonvulsant? Option A, Sudafed. Option B, Neurontin. Option C, Toprol-XL. Option D, Naloxone. The correct answer is option B, Neurontin. Question 288. What is the most common bacteria that causes most UTIs? Option A, Staphylococcus aureus. Option B, Pseudomonas aeruginosa. Option C, Escherichia coli. Option D, Enterococcus faecalis. The correct answer is option C, Escherichia coli. Question 289. Where should you hold the eyedropper when instilling eye drops? Option A, close enough to touch the cornea. Option B, 0.5 to 0.75 inches from the lid surface. Option C, 3 to 4 inches away from conjunctiva. Option D, 1 inch to 1.5 inches from the lid surface. The correct answer is option B, 0.5 to 0.75 inches from the lid surface. Question 290. When administering several medications at the same time, they must be given in a particular order. Which of the following is the correct order? Option A, tablets, liquids, syrups, and lozenges. Option B, liquids, syrups, tablets, and lozenges. Option C, lozenges, tablets, liquids, and syrups. Option D, syrups, liquids, tablets, and lozenges. The correct answer is option A, tablets, liquids, syrups, and lozenges. Question 291. A medical emergency can also arise due to a sudden life-threatening drug reaction, known as anaphylaxis. Which of the following is a sign of anaphylaxis? Option A, dry hives. Option B, shortness of breath. Option C, nausea. Option D, headache. The correct answer is option B, shortness of breath. Question 292. 1 pint equals blank blank milliliters. Option A, 100 ml. Option B, 200 ml. Option C, 500 ml. Option D, 300 ml. The correct answer is option C, 500 ml. Question 293. Which of the following is an example of a steroid medication? Option A, clindamycin. Option B, metoprolol. Option C, hydrocodone. Option D, prednisone. The correct answer is option D, prednisone. Question 294. A pulse rate that stays below 60 is considered an indication of blank blank. Option A, hypertension. Option B, bradycardia. Option C, hypotension. Option D, tachycardia. The correct answer is option B, bradycardia. Question 295. A provider may exchange a brand name drug for a less expensive form of the drug known as blank blank. Option A, trade name. Option B, chemical name. Option C, generic name. Option D, popular name. The correct answer is option C, generic name. Question 296. Which medication is administered for anxiety? Option A, diazepam. Option B, antivert. Option C, morphine. Option D, nitroglycerin. The correct answer is option A, diazepam. Question 297. Which medication is an anticoagulant? Option A, vitamin K. Option B, warfarin. Option C, ferrous sulfate. Option D, melatonin. The correct answer is option B, warfarin. Question 298. What is the generic name for Motrin? Option A, acetylsalicylic acid. Option B, Decatrin. Option C, ibuprofen. Option D, naproxen. The correct answer is option C, ibuprofen. Question 299. Which is the best way for an MACE to avoid spreading infection? Option A, wash hands. Option B, wear gloves while performing all procedures. Option C, apply lotion to hands frequently. Option D, wear a gown when entering residence rooms. The correct answer is option A, wash hands. Question 300. The Residence Bill of Rights includes all of the following except for blank blank. Option A, access to privacy. Option B, freedom from abuse. Option C, grievance without retribution. Option D, ability of the facility to discharge the resident without reason. The correct answer is option D, ability of the facility to discharge the resident without reason. Question 301. A resident has received a change of order from Lasix to 4-push Lasix. The medication aide realizes that according to the job description for medication administration aides blank blank. Option A, 4 medication can be administered by the MACE as long as a registered nurse is present. Option B, the medication aide cannot administer 4 medication under any conditions. Option C, the medication aide can administer the Lasix after the initial dose is given by the RN. Option D, the medication aide can administer the Lasix so long as the medication does not need to be titrated to effect. The correct answer is option B. The medication aide cannot administer 4 medication under any conditions. Question 302. When the RN delegates duties that are outside of the medication aide's job description blank blank. Option A, the medication aide is accountable for the RN's actions. Option B, the RN is accountable for the medication aide's actions. Option C, the RN is accountable for everyone's actions. Option D, the RN and the medication aide are responsible for the delegated actions. The correct answer is option D. The RN and the medication aide are responsible for the delegated actions. Question 303. True or false, failure to report a performance error could result in problems with the facility or with an accreditation agency. Option A, true. Option B, false. The correct answer is option A, true. Question 304. What is the next step after administering a medication to a resident? Option A, record the administration on the march. Option B, give the resident a bath. Option C, communicate to the nurse that the resident's medication has been administered. Option D, check the resident's identification. The correct answer is option A, record the administration on the MAR. Question 305. Which of the following conditions puts the resident at risk when receiving Inderal? Option A, heart attack. Option B, hypertension. Option C, COPD. Option D, irregular heartbeat. The correct answer is option C, COPD. Question 306. What is the most common side effect of alpha-1 adrenergic blockers? Option A, lightheadedness and syncope upon standing. Option B, inability to urinate. Option C, dry mouth. Option D, priapism. The correct answer is option A, lightheadedness and syncope upon standing. Question 307. Which of the following is a side effect of metformin? Option A, weight gain. Option B, diarrhea. Option C, dry skin. Option D, elevated blood sugar. The correct answer is option B, diarrhea. Question 308. A resident is receiving an antithyroid drug. Which of the following elements found in food should the resident avoid? Option A, sodium. Option B, potassium. Option C, iodine. Option D, magnesium. The correct answer is option C, iodine. Question 309. A resident who is taking antibiotics experiences a rash. What is this resident experiencing? Option A, adverse effect. Option B, anaphylactic. Option C, side effect. Option D, allergic reaction. The correct answer is option D, allergic reaction. Question 310. Potassium liquid should never be given without first being blank blank. Option A, diluted. Option B, iced. Option C, tested. Option D, sweetened. The correct answer is option A, Diluted. Question 311. Which of the following medications belong in the classification of an anti-Parkinson medication? Option A, Synthroid. Option B, Ginderol. Option C, Metformin. Option D, Sinemit. The correct answer is option D, Sinemit. Question 312. Patients who have reflux disease should avoid all of the following foods except for blank blank. Option A, peanuts. Option B, spicy foods. Option C, tomatoes, citrus, and onions. Option D, high-fat foods. The correct answer is option A, peanuts. Question 313. Which of the following medications could be used for hypertension? Option A, Inderal. Option B, Sinemit. Option C, Synthroid. Option D, glipizide. The correct answer is option A, Inderal. Question 314. Which of the following is not a diuretic? Option A, spironolactone. Option B, hydrochlorothiazide. Option C, triamterene. Option D, hydrocodone. The correct answer is option D, hydrocodone. Question 315. What is the minimum number of patient identifiers that should be used to make sure the right patient is getting the medication? Option A, 3. Option B, 1. Option C, 4. Option D, 2. The correct answer is option D, 2. Question 316. Which of the following medications is classified as an anti-hyperglycemic? Option A, Inderal. Option B, Sinemit. Option C, Synthroid. Option D, glipizide. The correct answer is option D, glipizide. Question 317. Considering the list of medications below, which one would be prescribed for psychoses? Option A, 5-FU. Option B, chlorpromazine. Option C, Valium. Option D, Bactrim DS. The correct answer is option B, chlorpromazine. Question 318. When approaching a combative patient, all of the following are correct except blank blank. Option A, stand over a combative client to show you are able to control him, her if necessary. Option B, approach in a calm, reassuring manner. Option C, speak slowly and clearly. Option D, ask for assistance as needed to maintain a safe distance as you approach the client. The correct answer is option A, stand over a combative client to show you are able to control him, her if necessary. Question 319. What is the single most important step for the medication aide to perform to prevent the spread of infection while administering medications? Option A, wash his or her hands frequently. Option B, wear protective eyewear. Option C, wear gloves. Option D, wash patient hands frequently. The correct answer is option A, wash his or her hands frequently. Question 320. True or false, if you have worn gloves while administering medications, it is not necessary for you to wash your hands. Option A, true. Option B, false. The correct answer is option B, false. Question 321. All of the following are important actions for the medication aide to prevent a lawsuit except blank blank. Option A, perform your duties according to your position description. Option B, flirt with family members and the patient. Option C, communicate effectively and efficiently. Option D, maintaining a positive attitude. The correct answer is option B, flirt with family members and the patient. Question 322. Which of following is one of the 6 rights of medication administration? Option A, right to refuse care. Option B, right dose. Option C, right to choose. Option D, right to request change in medication. The correct answer is option B, right dose. Question 323. Which of the following is the definition of ethics? Option A, the study of euthanasia. Option B, the science of doing good for others. Option C, a set of principles that professionals can use to help them make decisions. Option D, speaking the truth consistently and dependably. The correct answer is option C. A set of principles that professionals can use to help them make decisions. Question 324. When administering ear drops, you do all of the following except for what? Option A. Keep the medication in the refrigerator until just before administering it. Option B. Massage the ear after administering the medication. Option C. Remove any cerumen with a clean washcloth that may be blocking the medication instillation. Option D. Administer the medication to the prescribed ear only. The correct answer is option A. Keep the medication in the refrigerator until just before administering it. Question 325. All of the following are side effects of antineoplastic antibiotics except blank blank. Option A. Bone marrow depression. Option B. Alopecia. Option C. Hypertension. Option D. Skin irritation. The correct answer is option B. Alopecia. Question 326. You are not sure about a drug order and whether you should give the drug or not. What do you do? Option A. Call the pharmacist. Option B. Ask the charge nurse. Option C. Ignore the drug order. Option D. Ask the patient what to do. The correct answer is option B. Ask the charge nurse. Question 327. Which agency can deny, revoke, or suspend a Med-Aide certification? Option A. The Oregon Health Authority, OHA. Option B. The Oregon State Board of Nursing, OSBN. Option C. The National Council of State Boards of Nursing. Option D. The facility where the CMA is employed. The correct answer is option B. The Oregon State Board of Nursing, OSBN. Question 328. A nurse asks you to find out from the patient what their pain level is. What should you do? Option A. Talk with the patient and ask them what their pain scale number is. Option B. Refuse to do it and tell the nurse she needs to do this as it is their job. Option C. Ask the nursing assistant assigned to the patient to get this. Option D. Report the nurse to the administrator or DNS of the facility. The correct answer is option A. Talk with the patient and ask them what their pain scale number is. Question 329. Violating or failing to comply with the Controlled Substance Act is illegal. The result of this may be A. Being arrested and paying a fine. Option B. Being arrested and put in prison. Option C. Being arrested, paying a fine, and jail. Option D. Being investigated by the Board of Nursing. The correct answer is option C. Being arrested, paying a fine, and jail. Question 330. A drug interaction occurs when withdrawal symptoms occur if the drug is not taken. Option A. A person cannot control how the drug is absorbed. Option B. The drug's action is altered by another drug taken at the same time. Option C. The person begins to need a higher dose to achieve the same effect. D. The correct answer is option B. A drug's action is altered by another drug taken at the same time. Question 331. When a drug has an undesired effect that is not part of the goal of drug therapy, it is called a /. Option A. Side effect. Option B. Contraindication. Option C. The synergistic response. Option D. The idiosyncratic response. The correct answer is option A. Side effect. Question 332. Chose the correct number that Roman numeral 4 represents. Option A. 3. Option B. 4. Option C. 5. Option D. 6. The correct answer is option B. 4. Question 333. Mrs. Smith has a dentist appointment tomorrow. Looking at the MAR, you see that she is to get amoxicillin 500 mg the day before all her dental appointments. This is an example of what type of medication order? Option A. PRN order. Option B. Single order. Option C. Standing order. Option D. Stat order. The correct answer is option B. Single order. Question 334. A resident is being admitted to the facility later today. There are orders on the MAR for some PRN meds. These are not their regular medication orders. What kind of drug order is this? Option A. Stat order. Option B. PRN order. Option C, single order. Option D, standing order. The correct answer is option D, standing order. Question 335. How many teaspoons are in 1 tablespoon? Option A, 1. Option B, 2. Option C, 3. Option D, 4. The correct answer is option C, 3. Question 336. The medication order is not complete. What should you do? Option A. Give the drug and call the pharmacy to get a new order. Option B. Give the drug and ask the nurse to call the doctor to get a new order. Option C. Hold the drug and call the pharmacy to get a new order. Option D. Hold the drug and ask the nurse to check the order in the chart. The correct answer is option D. Hold the drug and ask the nurse to check the order in the chart. Question 337. Before giving any drug, you compare the label on the drug package against the A. Option A, MAR. Option B, Cardex. Option C, nurse's notes. Option D, of pharmacy notes. The correct answer is option A, MAR. Question 338. An antipruritic medication would be used to treat which condition? Option A, athlete's foot. Option B, an itchy rash. Option C, sunburn. Option D, scabies. The correct answer is option B, an itchy rash. Question 339. A sublingual drug is given. Option A, in the eye. Option B, under the skin. Option C, under the tongue. Option D, between the cheek and gums. The correct answer is option C, under the tongue. Question 340. Your resident has just had cataract surgery and has orders for eye drops. What do you do? Option A. Give them the eye drops as ordered. Option B. Let the nurse know you cannot give these meds. Option C. Have the patient give their eye drops themselves. Option D. A chart that the meds were not given. The correct answer is option B. Let the nurse know you cannot give these meds. Question 341. The CMA in Oregon may appropriately do which action? Option A. Administer parenteral medications. Option B. Reorder medications from the pharmacy. Option C. Gather the patient's medication history. Option D. Disposing of narcotics. The correct answer is option B. Reorder medications from the pharmacy. Question 342. The CMA is responsible for administering. Option A. Only the drugs learned in school. Option B. Meds under the supervision of a nurse. Option C. Medications by all routes. Option D. All medications ordered. The correct answer is option B. Meds under the supervision of a nurse. Question 343. The provider orders 5 mg of medication. The med label read 10 mg in 10 milliliters. How much med do you give? Option A, 10 milliliters. Option B, 2.5 milliliters. Option C, 50 milliliters. Option D, 5 milliliters. The correct answer is option B, 2.5 milliliters. Question 344. When administering ear medication to an adult patient, you would gently. Option A, pull the ear down and back. Option B, push the ear forward. Option C, just place the drop into the ear. Option D, pull the ear up and back. The correct answer is option D, pull the ear up and back. Question 345. Ophthalmic drugs are given by what route? Option A, in the ear. Option B, in the eye. Option C, in the nose. Option D, on the skin. The correct answer is option B, in the eye. Question 346. The term drug standards refers to. Option A, the official non-proprietary name of the drug. Option B, the Controlled Substances Act of 1970. Option C, the law that require labels and warnings against unsafe use. Option D, the law where drugs must be of uniform strength, quality, and purity. The correct answer is option D, the law where drugs must be of uniform strength, quality, and purity. Question 347. The patient has a medical condition where the medication, treatment, or surgery is not advised. What is this called? Option A, an adverse reaction. Option B, a precaution. Option C, a contraindication. Option D, of pharmacokinetics. The correct answer is option C, a contraindication. Question 348. Nan. Option A. The person takes an antiviral for their shingles, and then starts to take an antifungal for athlete's foot. Option B. The person has a weakened immune system from their autoimmune diagnosis. Option C. The person has a severe reaction to the antibiotic causing an anaphylactic response. Option D. The person is taking more than one antibiotic or is on a broad-spectrum antibiotic. The correct answer is option D. The person is taking more than one antibiotic or is on a broad-spectrum antibiotic. Question 349. Your resident is allergic to penicillin. They now have an infection that requires penicillin treatment. Which antibiotic would you expect the doctor to prescribe? Option A, tetracycline. Option B, sulfonamide. Option C, penicillin. Option D, cephalosporin. The correct answer is option D, cephalosporin. Question 350. You have been listed on the registry as a CMA for 7 months. Your birthday is coming. Now you need renew your CMA license. How many CEU hours do you need to renew? Option A, 0 hours. Option B, 1 hour. Option C, 2 hours. Option D, 3 hours. The correct answer is option C, 2 hours. Question 351. You have taken a position at an adult care home with 5 residents. The owner is not a nurse, but she has a home health agency that sends a nurse for one of the clients every week. Another client is on hospice and that agency sends the nurse over every week also. You know by the Oregon State Board of Nursing regulations that the hours on the job count towards your renewal of your CNA and CMA because there is a nurse in the house during the week. The hours will not count towards your renewal, so you decide to take a part-time position at the LT/skilled facility to get enough hours to renew. Option B, the hours count towards your renewal of your CNA and CMA because you are providing nursing assistant and medication aid tasks. Option C, the hours will not count because there is no nurse on staff, so you decide to volunteer with hospice for the hours you will need. The correct answer is option D, Nan. Question 352. What is the minimum number of hours on the job that you need to renew your certificate every 2 years? 400 in the booklet from the Oregon State Board of Nursing. Under the section titled Conduct Unbecoming of a Certified Medication Aide, you find items that you are not allowed to do by law. List one of these items: taking someone meds. What is something you should do before giving barbiturates? Option A, check heart rate. Option B, check pulse. Option C, check BP. Option D, check respiratory rate. The correct answer is option D, check respiratory rate. Question 353. What does penicillin treat? Bacterial infections. What is a common side effect of an antibiotic? Yeast infection. What eye condition/disease do we use NSAID medication for? Inflammation of cataract disease. How many minutes between 2 different eye medications? 5 minutes. Why do we use benzodiazepine? Anxiety MAOI. What kind of diet do they have to be on? Low tyramine diet. What vasodilators do? Open dilate blood vessels. Common benzodilator drugs. Nitroglycerin nitrates are used for dilating. Coronary artery used for angina. Chest pain. Side effect of vasodilator. Side effect of vasodilator. Dizziness, nausea, vomiting, palpitations, postural hypotension, trembling, fever, flushing, irregular heartbeat, diarrhea, edema, and seizures. Common antiplatelet drugs. Aspirin, clopidogrel. How do antiplatelet drugs work? Preventing platelets from aggregating. What digoxin does? Increase cardiac output and slows the pulse rate. Used for arterial fib/heart failure. BP drug. Common early symptom of digoxin toxicity: anorexia, nausea, vomiting, visual changes, cardiac arrhythmias, and pulse less than 60. What does an emetic do? Causes person to throw up. Drugs to prevent vomiting. Antiemetic side effects of NSAIDs: nausea, diarrhea, headaches, dizziness, GI upset. What disease do we treat using NSAIDs? Arthritis. Adverse reaction to a NSAID: stomach ulcers, ringing in the ears, renal impairment, abdominal upset, and pain. To follow the rules of documentation for a drug, U record. Option A, giving narcotic meds at the end of the shift. Option B, when a drug was not given and why. Option C, the administration of meds while preparing them. Option D, meds that another CMA gave. The correct answer is option B, when a drug was not given and why. Question 354. What commonplace gout occurs? Big toe classification of Coumadin, Warfarin. Anticoagulant patient teaching of Coumadin. Teach foods high in vitamin K which increases clotting. Patients may need to reduce intake. Need to keep amount of foods high in K like greens, broccoli, cabbage constant. Side effect or liquid iron. Stains teeth. What a antilipemic is for? Liquid lowering agent. Angina. Cholesterol. What type of diabetes does an oral anti-glycemic treat? Type 2 diabetes. What does proton pump inhibitor treat? GERD. What type of laxative is Colis? Stool softener. Decongestants are used for upper airway congestion. What type of diuretic is Lasix? Loop diuretic. What does an expectorant do? Wet cough, thins mucus and liquefies phlegm. Makes you cough. Lithium used for bipolar disorder. Patient teaching for antiplatelet. Bleeding precautions. Easily bruising. OTC. To avoid equals ginkgo and garlic. If going to the dentist, let them know about treatment. What are bronchodilator used for? Opening airways. Antitussive used for nagging dry, non-productive cough. Do not want to completely stop a productive cough. Parts of a valid drug order. Full name, date of order, name of drug, dosage, route, frequency. Define hemoglobin. Iron containing substance that carries oxygen from the lungs into the tissue. 3 safety checks are: 1. Compare before taking it from the shelf/drawer. 2. Compare as you remove drug from container. 3. Compare before you place the drug in medication cup. How to put on a nitroglycerin patch on. Always wear gloves when putting patches on. Remove current patch, wipe of residual paste, apply paste, amount ordered, to patch, initial and date patch, place paste and paper. Do not massage it in, cover with tape. For basic body process that affect drug action, pharmacokinetics, 1. Absorption. 2. Distribution. 3. Metabolism. 4. Excretion, which describes additional effects on the body that are not part of the goal of drug therapy. Side effects, which term describes the interaction of two drugs to inhibit or cancel each other effects. Antagonism, anti equals two meds not working, which term describes a drug interaction of two drugs in combination is greater than the effect of each drugs given separately. Synergism, sync equals greater together, drug interaction when two drugs are given at the same time, and one drug increases the effect of the other. Potentiation, the ability of a drug to cross a cell membrane and the rate at which it can do effects. Which of the following? Pharmacokinetics, how quickly and completely a drug is absorbed into the bloodstream. Effects, which of the following? Drug action, which is an example of a drug that is given sublingual route. Option A, ibuprofen. Option B, nitroglycerin. Option C, epinephrine. Option D, Demerol. The correct answer is option B, nitroglycerin. Question 355. Patients who take sedatives are advised to avoid drinking to avoid the possibility of option A, antagonism, option B, synergism, option C, potentiation, option D, toxicity. The correct answer is option C, potentiation. Question 356. The process whereby antacids and iron supplements work against the absorption of the antibiotic tetracycline is described as option A, antagonism, option B, synergism, option C, potentiation, option D, idiosyncrasy. The correct answer is option A, antagonism. Question 357. What are the classifications of medication forms? Liquid, semi-liquids, semi-solids, solid. Which term describes drugs that are able to dissolve in water? Soluble. What preparation should be shaken first? Option A, suspension. Option B, solution. Option C, spirit. Option D, syrup. The correct answer is option A, suspension. Question 358. All the types of meds can be administered to alcoholics or diabetics. Expect fluid extracts. What type of med can lead to an overdose if crushed, opened, or emptied into food? Spapsules. What is found in sunlight? Yellow fruits and veggies and green leafy veggies. Fat-soluble vitamins. What vitamin deficiency cause blindness? Vit A, which is not a fat-soluble vitamin. Vitamin B and C, which term indicates drugs that kill microorganisms directly? Bactericidal. What antibiotic is given to someone allergic to penicillin? Cephalosporins. What should be avoided because they interact with cephalosporins and produce abdominal pain, nausea, vomiting, decreased BP, rapid pulse and sweating? Alcohol. Which antibiotic poses a greater risk of superinfection? Tetracyclines. Patients taking sulfonamides such as Bactrim and Septra must drink at least 3 quarts of fluid per day. Warfarin is classified as anticoagulant. Digoxin shouldn't be given if pulse is below 60. Which category of meds are cough suppressants? Antitussives. Which category of drugs liquefy or break down mucus so it can be coughed up? Expectorants. Which category of drugs are vasoconstrictors used for nasal congestion because they shrink engorged mucous membranes? Decongestants. Which category of drugs increases the vital capacity of the lungs by dilating the bronchi and relaxing smooth muscle? Bronchodilators. Which category of drugs neutralize HCI in the stomach? Antacids. Which drug is an example of an emetic, type of drug that produces vomiting in cases of poisoning? Syrup of ipecac. Which drug suppress nauseas and vomiting? Antiemetics. Treats intestinal parasites. Antihelmintic furosemide, Lasix, is an example of loop diuretic. Which of the following is acid effect combining nitroglycerin and Viagra? Hypotension. Most common UTI for older men. Prostatitis. Which of the following conditions may be indicated by symptoms that include a decrease in the urinary stream, dribbling, and the inability to empty bladder? Benign prostatic hyperplasia. Which is a drug that decreases the symptoms of benign prostatic hypertrophy? Flomax. An intolerance to cold, personality changes, fatigue, dry skin, brittle nails, slow speech and weight gain may be symptoms of hypothyroidism. What is necessary for adequate production of thyroxine and triiodothyronine? Iodine. Where are the adrenal glands located? On top of the kidneys. Large doses of blank are given to combat allergic reactions and inflammation. Epinephrine. Which of the following types of tissues attach muscles to bone? Tendons. Which of the following terms describes an inflammation of the joints that starts when there is an excess of uric acid in the bloodstream? Gout. Osteoporosis is also called degenerative bone disease. What structures are affected by osteoarthritis? Spine, hips and knees. Methotrexate is used to treat what? Rheumatoid arthritis. Which of the following is a drug that reduces formation of uric acid? Antihyperuricemic. Which of the following terms describes a wasting away of body tissue? Atrophy. Which of the following categories of drug are pain relievers? Analgesics. Levodopa/carbidopa is used for Parkinson's disease. Which drug decreases the number of strokes? Aspirin. 1 teaspoon of elixir is equal to: Option A, 10 milliliters. Option B, 5 milliliters. Option C, 1 ounce. Option D, 1 cup. The correct answer is option B, 5 milliliters. Question 359. Storing medications correctly and legally is very important. Which of the following actions shows the correct method? Option A, medications with similar names are stored together. Option B, roommates' meds are stored together. Option C, all medications are stored in their own containers. Option D, all opened meds must be kept in the med cart. The correct answer is option C. All medications are stored in their own containers. Question 360. All of the following are oral forms of medications except: Option A, powders. Option B, topicals. Option C, syrups. Option D, enteric-coated. The correct answer is option B, topicals. Question 361. All of the following are topical medications except: Option A, ointments. Option B, creams. Option C, gels. Option D, syrups. The correct answer is option D, syrups. Question 362. Your resident just started a course of metronidazole, Flagyl, and is now complaining of a metallic taste in their mouth. You know that this is what condition? Option A, a common side effect. Option B, a toxic effect. Option C, a medication-caused psychosis. Option D, the person is making this up. The correct answer is option A, a common side effect. Question 363. Medications used for thyroid problems have a common side effect of what? Option A, tachycardia. Option B, bradycardia. Option C, hypotension. Option D, hypertension. The correct answer is option A, tachycardia. Question 364. A common side effect of oral antidiabetic medications is option A, low blood sugar. Option B, diarrhea. Option C, sedative effects. Option D, hypertension. The correct answer is option B, diarrhea. Question 365. What class of medications is commonly used in people with bipolar depressive disorders? Option A, antipsychotic meds. Option B, tricyclic meds. Option C, SSRIs. Option D, MAOIs. The correct answer is option D, MAOIs. Question 366. We classify medications in several ways. Which is one way to classify drugs? Option A, action of drugs. Option B, side effects. Option C, contraindications. Option D, interactions. The correct answer is option A, action of drugs. Question 367. What is the action of an antiviral medication? Option A, prevents the virus from making more virus. Option B, kills the virus. Option C, subdues the virus while the body can kills it. Option D, increases killer T cells to destroy it. The correct answer is option A, prevents the virus from making more virus. Question 368. Diuretics are often ordered first to treat high blood pressure for all the following reasons except which one? Option A, they have fewer side effects. Option B, they work well to help lower blood pressure. Option C, they work quickly to reduce blood pressure. Option D, they help to decrease urination. The correct answer is option D, they help to decrease urination. Question 369. What is a common side effect of antidysrhythmic medications that the CMA should watch for? Option A, increased heart rate. Option B, fatigue. Option C, low heart rate. Option D, high blood pressure. The correct answer is option C, low heart rate. Question 370. A medication is given for relief of anxiety but causes the resident to become more anxious. This is called option A, idiosyncratic. Option B, synergistic. Option C, antagonist. Option D, potentiation. The correct answer is option A, idiosyncratic. Question 371. Your resident gets a thyroid medication. You should administer this to them in the morning, on an empty stomach, and the resident should. Option A, wait for 3 to 4 hours before eating. Option B, not eat for at least an hour but may have something to drink. Option C, wait for at least 15 minutes before eating. Option D, wait at least 30 minutes before drinking. The correct answer is option D, wait at least 30 minutes before drinking. Question 372. The reaction to anti-hyperglycemic medication that causes a person to become shaky and feel nervous and confused is option A, hyperglycemia. Option B, hypothyroidism. Option C, hypoglycemia. Option D, hypertension. The correct answer is option C, hypoglycemia. Question 373. When a drug's action changes the resident's response in a positive way, the drug is said to provide a option A, drug action effect. Option B, dose-dependent effect. Option C, therapeutic effect. Option D, synergistic effect. The correct answer is option C, therapeutic effect. Question 374. As a CMA in Oregon, you have permitted routes and prohibited routes to administer medications. Choose the answer that gives you permitted routes. Option A, subcutaneous route for insulin. Option B, nasal gastric tube, ING. Option C, transdermal. Option D, ostomy. The correct answer is option C, transdermal. Question 375. As a CMA in Oregon, you have permitted routes and prohibited routes to administer medications. Chose the answer that gives you prohibited routes. Option A, metered dose inhaler, MDI. Option B, medication via tubes. Option C, rectal. Option D, nebulizer. The correct answer is option B, medication via tubes. Question 376. Your resident is now on a medication for her depression. Which subclassification is an antidepressant drug? Option A, beta blockers. Option B, tricyclics. Option C, hormones. Option D, antipsychotics. The correct answer is option B, tricyclics. Question 377. What is the action of an analgesic? Option A, destroy microorganisms. Option B, prevent and treat diarrhea. Option C, reduce edema. Option D, reduce and relieve pain. The correct answer is option D, reduce and relieve pain. Question 378. What is the action of an antibiotic? Option A, destroy or inhibit the growth of pathogens. Option B, used to treat and prevent cancer. Option C, destroy or inhibit the spread of viruses. Option D, used to treat a fungal infection. The correct answer is option A, destroy or inhibit the growth of pathogens. Question 379. Tardive dyskinesia should be closely observed for when a person is on what type of CNS medication? Option A, benzodiazepines. Option B, anxiolytics. Option C, antipsychotics. Option D, antidepressants. The correct answer is option C, antipsychotics. Question 380. Your patient is taking warfarin, Coumadin. They now have cold symptoms and want to take echinacea for this. You know that the following will happen if they do take this herbal remedy. Option A. It is fine for the resident to take this as it has no effect on Coumadin. Option B. It is not okay because it will stop the Coumadin from working. Option C. It is not okay because the Coumadin makes the echinacea ineffective. Option D. It is not okay because echinacea makes Coumadin more potent. The correct answer is option D. It is not okay because echinacea makes Coumadin more potent. Question 381. Your resident is on digoxin. Labs show it is in range of being therapeutic, but you are not seeing therapeutic effect. You talk with the person and find that they are on which concerning herbal remedy? Option A, echinacea. Option B, ginkgo. Option C, ginseng. Option D, St. John's wort. The correct answer is option D, St. John's wort.